Welcome back to Daniyal Ultrasound Clinic. This is Dr. Munir Abbasi. Today we have a case of a patient who has 3 months amenorrhea or overdue 3 months. Now let us see what shows up on ultrasound. This is the skin of pelvis showing this is outline of the uterus and this is over it. This is urinary bladder. Now on ultrasound examination the uterus appears bulky and a gestational sac is seen displaced from its normal fundal location. Here is the gestational sac which should have been in the fundal area. Rather than in the fundal area, it has been displaced to the lower uterine segment. Now, instead of what I wanted to show you that gestational sac is not located on its anatomical position. Instead of being normally situated in the uterine cavity, the sac is seen extending towards the body and cervical canal, and this is suggestive of descent of the gestational sac. The sac margins you see here are irregular and there is no evidence of fetal pole or any cardiac activity within it. The cervical os appears open or funneling like you see here. This is real time, and there may be some fluid or debris in the cervical area, and these all findings are characteristic sonographic findings of an inevitable abortion. Now let us measure the gestational sac. It measures approximately in transverse section. We have to measure it. Here it is. It measures approximately 3.8 centimeters. So now the impression is, again I tell you, here is the fundal area, endometrial canal in the fundal area. This is the sac. The impression would be a displaced gestational sac extending towards body and cervical areas, and these findings are suggestive of inevitable abortion. Now let me explain few points here for the viewers. Actually, in such cases, the pregnancy is unfortunately non-viable and the sex descent into the cervical region indicates that expulsion is inevitable. This condition is often accompanied by bleeding or cramping, as the patient complains here, and clinical correlation with the patient's symptoms is essential here. So I asked in the first beginning patient about the complaints. She complains of cramping and bleeding, little small mild bleeding per vagina. So ultrasound actually plays key role in confirming this diagnosis and guidance or guiding the further management. So this was the case of inevitable abortion with the sac descent, gestational sac descent into the cervical area. Thank you very much.